free healthcare, I'd like to welcome to the stage Jeff McLeod, who's the Senior Digital Product Designer from Zymedica. He is, and Zymedica is a med tech company. They design innovative medical devices, and his work is focused on connected health devices for physicians, consumers, including mobile apps, Zero UI, which is a big focus of this talk, and complex surgical equipment. Let's welcome him to the stage.
Is the clicker up there?
Yeah, the clicker's
okay, thanks. So walking through the trade show floor, there were so many different applications of the Amazon Echo. There's even applications with a washing dryer machine and a TV, all incorporating these Zero UI, and Amazon Echo is just one of these Zero UI things. So what they really are, meaning zero visual UI. So there's voice, haptics, and even gestures to be able to actually interact with technology in the digital world. And that really has an opportunity to really improve and drive, reduce barriers in the healthcare environment. But let's first take a step back and take a look at history. And technology has a history of fading into the background and becoming ubiquitous, and often changes from a negative association. So take, for example, power. At the Industrial Revolution, you had smokestacks that were symbols of power. They're actually very ornate. You can actually see it in actually how it's designed. That was a showcase of prestige and power. Today, we now have the same pollution, or the same smokestacks representing something completely different, representing pollution. The connected care devices, this represents a clinician with access to multiple different providers with their electronic medical records. But at the same time, they now represent distraction and Pokemon Go, people not paying attention. What the symbol at the same time as the smokestack, you had the prestige of medicine representing life, and that was actually represented in the architecture. It looks like a state house. Now we have a bleak, stark system of the hospital system where people go eventually to die and never leave. So the point is the celebration for technology's sake, doesn't really have staying power. We really recommend focusing on understanding the user and really facilitating that with technology. So we really, at Zymedica, really spend a lot of time in clinics, in ORs, and even people's homes to really understand what people care about. They care about living lifestyle, giving their life, what they really want to do. They want to have dignity and be perceived as having dignity. They need to have peace of mind and a way to manage the stresses of everyday life anxiety. They also need reassurance that, are they actually doing the right thing? Are they actually having the right, or they need to readjust their care plan? So Zero UI has a really good opportunity to kind of support people's humanity. So let's take a look back at what it is. So Zero UI is the interface. Amazon Echo is just one of those Zero UI interfaces, but you can also have it provide access to artificial intelligence to provide actionable data on a human scale. And they can interact with this without having to learn another device, without having to learn another mobile device or a complex electronic medical record system. They can understand it and interact it through voice or gestures, and even monitor their behavior. And they can interact that with the world, interact with it and extend it from the digital world onto the physical world, be able to actually control lights and other connected devices in the physical. So let's take a look at some Zero UI users. So these are some personal examples. This is Va. She's 93 years old. She's a writer and loves listening to old music, but she's my grandmother. And she also has some mobility issues. As you can see, she requires a walker to get around. Her central vision is kind of fading a little bit, so she can't really see screens or on TV as well, and can't really read paper as much. So she uses the Amazon Echo to be able to interact and hear the news and the weather and things like that, to be able to live independently and not constantly having to struggle with seeing things. She also needs, because she uses a walker, she has trouble turning on and off lights going through the house, so she uses it to turn on and off lights so she can actually see better and not actually fall. Again, another personal example. This is my daughter. She's 1. So according to the American Pediatric Society, they recommend no visual interfaces below 18 months. And above that, they've actually reduced the amount of screen time from 2 hours to 1 hour. So if you contrast to this hyper-connected world, and we're all checking our Twitter feed and showing our mobile devices, there's actually a study by the Consumer, there's a study by the Consumer Common Sense Medical Society that says 9.5 hours of screen time by parents with children is the average. And that's when you accommodate for how many, not even including work time. So that's a stark contrast with what's recommended and what people are actually doing. So if you actually see, compared to what we actually do with the Amazon Echo and my daughter, is we actually interact with the news in a non-visual sense. And then we're able to interact with her in a shared environment. And then, occasionally, as children do, she gets upset. We're able to access Elmo's song, which she really loves. So then it's able to help with parenting. Let's contrast this to healthcare. Healthcare is often just sit there and wait for the doctor to come up. Meanwhile, you're really worried about why you're in there in the first place. The nurse comes in there, tells you to wear a paper gown, and then you come in and a fully dressed, well-dressed doctor comes up and tells you how to change your life. And then you're sent home, have a 6-month follow-up, giving a complex care regimen, and you're wondering how to pay for it. You wonder who's going to be responsible. Am I doing it right? So really, if you can contrast this to healthcare, there's really little consideration for lifestyle. If you have the average 7 minutes in front of a clinician, you're not really going to get that what it really means to that one individual is, I need to have the stamina to be able to play 9 holes of golf and be able to have my care plan represent that so I have that ability. No dignity. Being in a paper gown while a person comes in is not exactly dignified. There's a lot of complexity, both from the provider and for the patient's perspective, and less peace of mind. There's often more confusion and less reassurance. There's really what is this going to cost? Do you know what's going to cost? How do I know if I'm doing the right thing within that 6 months between my provider visit? So luckily, we have the startings of Zero UI in healthcare coming up. A couple years ago, we had the Microsoft Kinects used in aging adults to be able to use their physical therapy. And then Boston Children's more recently in the news has used Zero UI and Amazon Echoes in patients, as well as they've created applications for the home use for children's. As well as there's 2 Apple former execs setting up a startup in the UK to fill pharmaceuticals from the voice interfaces for people at home. In addition, there's also apps available on the Amazon Echo to calculate your bolus injections for insulin. You give it carbohydrates and it actually tells you how much you're using. So at Zyme we really have a Zero UI focus vision for the OR. We really want to understand this complex OR system and to be able to create actual data that people can understand while they're actually in the OR. We need to understand who's doing what inside and outside of the sterile field and be able to get alarms and alerts, be able to be interacted with gestures, and be able to access clinical decision support using voice. Be able to monitor that and be able to tie that back into the EHR using health data standards. Additionally, we want to get a whole kind of holistic view of what's actually happening with the patients, what's happening with activity of the other clinicians, and then what's happening with the device itself. Again, we also want to create the vision of Zero UI with the point of care. So be able to take those precious 7 minutes and have that clinician be able to stand and face the patient and really actually be able to talk and engage that patient with telling the care plan, and not be able to turn their back and then type into the EHR. There's always those considerations for the doctor to be able to document what that care plan is, but have access to the Echo to use natural language processing to document what's happening. Code those up into the EHR so they don't have to be slaves to the computer system and having a visual UI. Additionally, we have access to connected medication adherence devices, so the patient is able to be reassured that they're actually doing the right thing and then see that what information they're providing the clinician. And then have this whole entire thing be able to have a natural environment. The doctor is able to say, hey, let's go and experience your medical record together. Let's go and say, you've gone from this part of your A1C and you've actually improved this much. And they're able to present that in a very easy to understand for both the patient and the clinician. Excuse me. Again, with aging in place, this is one of the things that is most appropriate for VAW, is being able to have the patients live where they want to live, have a consideration for lifestyle. They don't want to live, they don't want to die in a clinician, or they don't in a hospital. They want to be able to live at home. So having the 6+ providers be able to coordinate care using that interface and having one interface for the clinician, and be able to understand using remote monitoring of the vitals, of the medication adherence, and physical activity. And then be able to create a dynamic care plan across providers. And so they have one point of contact with this Zero UI contact. And then you can move from a 3 providers per week system, where you actually have appointments 3 times a week, to actually having a care on demand. So this would really dramatically change lifestyle. This is what we're promoting in our vision as a Medica. So kind of in summary, we want to make sure that we're not celebrating technology for technology's sake, and we're actually reducing the barriers to actually interact with this by promoting and understanding what people care about, and then actually bringing humanity. So we can go from a place of death and despair to a place of humanity. Thanks.